Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Monigle, welcome and thank you for joining us for the Ultimate Healthcare Brand Experience and Culture Playbook. In today's webinar, you'll hear highlights from Humanizing Brand Experience Volume 6. This newly released report from Monigle can help you unlock actionable opportunities to drive brand experience and culture change in your organization. Here to guide us through the highlights are two senior executives from Monigle, Grant Mason, Executive Director Insights, and Carolyn Bugg, Executive Director Strategy. Before I turn the program over to Grant and Carolyn, one quick note. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as we can in the time we have. With that, I'll turn the program over to Grant to kick us off.
Thanks, Daniel. Good to see you all today. Happy to walk you through today's brand experience and culture playbook. My name is Grant Mason. I head up the Insights group at Monigle and lead all of our healthcare research and this study, the Humanizing Brand Experience study.
Hi, everyone. My name is Carolyn Bugg. I'm the Executive Director of the Strategy team at Monigle. I partner really closely with Grant on all of our healthcare engagements, as well as assisting in the storytelling associated with the data that you're going to be seeing today. So really excited to be here.
So the whole theme today of this particular study is going to be around how do we re-engage consumers in healthcare. You're going to see that really there is this stagnation in terms of their relationship with us as healthcare organizations, but also with their own health and wellness. So what can we really do today to make that impact and re-engage consumers with healthcare and wellness? Now, today's summary is a summary. Obviously, this executive readout is from our book, which is also published, and you'll be receiving a link to. There is a lot of content, so bear with us. We're going to hit the high notes, and we are going to save questions for the end, but please do post them in the chat and in the Q&A, and we'll get to those at the end of today's session. I'm going to kick us off with the first chapter today, which really focuses on this idea of healthcare engagement and what we're seeing in terms of this stagnation. Now, since 2020, we've had a very consistent way of measuring people's personal engagement with their health and wellness. And that's what you're looking at on this page here. It's actually an index score based on a range of attributes you're going to see on the next page. But the big takeout is that pre-COVID, and that 2020 readout was based on pre-COVID data, people were much more engaged with their health and wellness than they are now. And obviously, as we've gone through that COVID period and exited it, we've not seen a recovery in people's ability to engage in health and wellness like we did back in 2020. So what's going on? These are all the attributes that feed into that engagement index score. And this whole set of attributes are really based on people's own personal relationship with their health and wellness. And what you're looking at here is the change in those scores since last year. Now, overall, it's fairly consistent, but we are seeing some improvements in people's focus on doing their own research when it comes to symptoms and or treatments. And also a big increase in folks focusing on really setting those personal healthcare goals. So yeah, I just wanted to call that out, that we are seeing some shifts in those areas, but overall the trend is still very much down since pre-COVID. And you can see that on this page here. So why is engagement declining since that pre-COVID period in 2020? Well, there's really three areas we've seen decline since that time. And those three areas are, for starters, people are not as interested in watching or reading about health and wellness related topics. You can see that's declined 5 points. In terms of people wanting to even be a go-to and have advice for friends and family, that's also declined. So that peer-to-peer recommendation is not to the levels it's been 4 years ago. And then lastly, the appetite for new approaches in terms of innovation and taking care of my health and wellness has also dropped off. So there are some downward trends we're seeing here in terms of personal engagement with healthcare. We do look at that healthcare engagement by market. That's a really important important part of our analysis for calculating the brand rankings, which I'll discuss later on. But it is worth noting that depending on where you are in the US, there is varying levels of engagement in healthcare. Miami, for example, has the highest engagement in the US when it comes to people's focus on their health and wellness. And you can see some other markets here that are slightly less engaged. Maine, interestingly, is the least engaged of the markets that we evaluate in this study.
So I'm going to jump now into chapter 2 and building off of some of the stagnation that we're seeing and feeling in the healthcare market. We wanted to understand what was influencing that. So as part of that sort of category engagement story, this notion of control, one of those attributes that's most associated with trust, is something that's declining with consumers. And that's something that we're going to look at in this chapter. So when you look at the trust attribute in humanizing brand experience, one of the things that you're going to see is that distrust in healthcare is higher than it ever has been. So we've spoken at length, sort of in past reports, about goodwill and how we're inspiring trust, and that bump that likely came, particularly as a result of individual brands and our collective industry kind of responding to COVID in ways that are meaningful. But this improvement is gone. And people have really gone back to trusting our brands even less than they did before COVID. And when we continue to see these low levels of trust in the lower age groups in the market, it's something that we really want to kind of pay attention to. It's not necessarily surprising that those that we've had an ability to really kind of form deeper relationships with over the years have a higher orientation to trust with us longer term. But the longer proportion of those times with which we're not necessarily engaging with younger consumers have really set a different set of alternatives and a different set of expectations. They're not oriented to trust us as much as some of the older generations, and that could become problematic, acknowledging that they are the next generation of healthcare consumers. So we wanted to dive a little bit deeper into that, and we wanted to look at the relationship between trust and the rest of the attributes in this study. So what you're looking at on this page is an analysis of these attributes and how they most strongly correlate back to trust. There's really 2 themes that have emerged that we want you to take a look at. The first is that you see things like caring staff, respected staff, and staffing all sitting up in the top 5 most correlated attributes to trust. So what we're really seeing here is a very people-oriented, people-centric view of how trust is interpreted. Then we want to notice sort of self-care and individualization really rounding out that top 5. What this is really reinforcing for us is the importance of tailoring our story to individuals themselves and the need to be a story of empowerment. So as we think about this, it's really making people feel like a top priority that's ultimately going to matter. I think one other really important call on this page is the notion that while quality outcomes did make it into the top 10, it is not in the top 5. It's no longer one of the strongest correlations with trust. The reason that that's important is that we're really starting to see more of these human-centric emotional motivators rising to the top as we think about correlations with trust, when historically intellectual drivers and intellectual attributes tended to be more correlated to these particular attributes. So definitely a shift in terms of how people are perceiving that. And before we close out this chapter, we did want to give a shout out to some of the standout brands that are scoring well on the dimension of trust, just because it is such an interesting factor in this year's study. There are brands out there, really big and small, that are really effective at creating trust-based relationships with their consumers. So you can see Emory here at the top of the list. And then, of course, some known players like Mayo Clinic, Johns Hopkins, Northwestern as well. They all represent the highest levels of consumer trust in our industry. Each is offering opportunities to really kind of improve performance in that attribute, but we did want to kind of call out those top 10 brands in this area.
Thanks, Carolyn. So the next chapter is really going to focus on systemness and consumers' relationship with systemness. The good news is we are seeing a return to consumer preference for systemness. Now, we've asked this question going back 4 years, where we actually look at, do consumers prefer a system for each of these different channels versus an independent organization? And that's the percentage you're looking at here, is that preference for a system over an independent for each of these services. And you can see in the last year that we are seeing growth for preference for systems. I will say, though, that back in 2020, when we had that highest level of engagement that we talked about earlier, the preference for system was even stronger than it is now. So we are seeing a recovery, but not quite back to those 2020 levels for systems. And this is very much true at the service line level as well. It's a very similar trend. In the last year, we have seen an uptick. You can see 2 to 3 points in preference gain for systems over independents for each of these service lines. But again, not quite to the levels we saw in 2020, albeit we didn't have the same amount of services we were tracking back then. So why? Why are we seeing this return to systemness? What are the reasons that consumers value a health system over an independent? Well, we asked them, and these results here are actually based on unaided, coded up responses. I think one of the biggest moves we've seen in these responses in the last 3 years is, again, going back to kind of those pre-pandemic levels. When you actually look at why consumers were choosing health systems, it was because often of our convenience and the centralized locations that we offered. Now, in the peak of the pandemic, that actually dropped off. Those weren't really benefits anymore because everyone was accessing care virtually and working remotely. And you can really see that in that 4% and 1% decline there. But in the last year, they've started to recover again. So as people have started to go back to more of a hybrid work model, started to kind of go to more in-person appointments, the value of that convenience and location is elevating. And we're seeing that return to systemness as a result. This is the full list of reasons why consumers do prefer health systems and the benefits of health systems, again, based on unaided responses. And you can see some of these verbatim and quotes on the right-hand side here for some extra color. But the real reason that consumers see value in health systems is because they believe it gives them access to a wider range of staff and specialists. And then critically, there is this theme throughout in these responses of, well, if you're a health system, you're going to be more collaborative, you're going to offer better communication, and it's going to be easier for me. As a consumer, it's going to be easier for me to access my records, easier for me to access care. You have more resources and more technology. So you can kind of see the hierarchy of benefits consumers expect from a health system and why there is that preference that is reappearing as we look at our data. We also interviewed Sarah Sanders, who is the Chief Marketing and Brand Experience Officer at UCSF, to kind of talk to us about what systemness means to their organization and how they define the benefits of systemness for their consumers. And they really broke it down into 3 key benefits as they saw systemness and the culture of systemness. This idea that systemness enables organizations to really invest more and create more personalized experiences while also tackling those big universal challenges that face people in terms of access to healthcare. And kind of taking that a step further, something else Sarah really brought up is this idea that as a system, they're empowered to actually really be more thoughtful and intentional when it comes to reaching all populations, including those underserved populations, and making sure that they have better access to care. And then the third way that really UCSF looks at the culture of their systemness is, less about operating as a top-down system, but more as an authentic one that reflects what their patients want in terms of that patient story. So yes, systems are big. Yes, they have more resources, but we can't lose that patient centricity, and making the patient the center to every experience is a key part of the culture at UCSF.
So one of the things that we heard from folks last year when we were doing this study is that you were really interested in understanding and maybe taking a deep dive in 2023 relative to loyalty programs and how they do or might work in healthcare, and also acknowledging that there are probably some lessons learned that we can take from outside of the industry and think about how we implement loyalty programs successfully. So that's what this chapter is really going to be focused on. So one of the things that we did is we started by asking people how interested they are in a healthcare loyalty program in general. I think you can see here that there's a variety of answers, and they're really built around the commitment of keeping care within a singular healthcare system. So the idea here is that we asked folks, If we were to incentivize you to keep your care within a singular healthcare system, that doesn't mean that you don't go out to other providers, you don't kind of spread your healthcare around. Would you be interested in loyalty and or rewards program in return? You can see the responses are pretty evenly distributed, predominantly because this is such an unusual or currently unexpected type of engagement within the healthcare system. So we want to take a little bit of a deeper dive and say, okay, well, for those who are interested, how would you build a loyalty program? So if we were thinking about building something from scratch and taking a look at the benefits of, say, other loyalty established industries, where we've really kind of trained consumers what to expect, it's not necessarily surprising then what you see sort of pop to the top relative to a potential healthcare loyalty-based incentive program. So topping the list are things like discounts and savings and other types of sort of spendable currency that put real dollars back into the pockets of their members. And even if they aren't directly related to healthcare services, this idea of getting costs back is really beneficial, especially acknowledging that the rising cost of care across the country is so prevalent. Every little bit essentially helps. And so when we think about a program being built around these benefits, it could really work double duty to drive loyalty as well as demonstrate that we're working really diligently to address cost concerns that our communities and our patients have relative to their care. So we think about this in an even more precise way. We go a level deeper and ask consumers, okay, well, what if healthcare organizations could offer you these specific rewards and benefits? So what you start to see kind of top this list are consumers are thinking things like free annual wellness checks, extended hours, fast track booking, maybe even a free gym membership, rounding out the top four. What we're seeing here is that many of these benefits that are rising to the top are really consistent with how consumers have been essentially trained to expect sort of rewards and recognition from CPG, retail, other based loyalty programs that exist out of the healthcare category.
So for the fifth chapter, this is quite an important trend that we've seen this year, and it's important for a few different reasons. But what we're actually seeing is people are opting out of healthcare right now because it's not working for them. And one of the biggest segments we're seeing growing in the population is what we call the doctor dodger. So we're going to dig into that in this chapter. So what's going on? We have a whole range of attitudes that we ask as a part of our segmentation in this study. And what you're looking at here are 4 of the attitudes that have changed the most in the last year. So these are the 4 attitudinal big changes since the previous version of the study. And what's happening is more people now are only going to the doctor when they are sick. So that's an 8-point increase in people only going to the doctor when they really have to. We've seen an 8-point decrease in people saying they are proactive when it comes to managing their health. We're seeing a 7-point increase in people saying they avoid going to the doctor even when they need to. And also a 7-point increase in people saying they don't have the time to go to the doctor. So these are some pretty significant moves we're seeing in people basically avoiding care when they need it. And that is concerning, I think. And we're going to have a look at what's going on behind that. Now, when we ask people why they delay care, and we have been doing this for the last 4 years now, they can select a whole range of options. And this year, what we're actually seeing, I don't think it will be a surprise, we're seeing an increase in people now saying that cost is a barrier, expense is a barrier. I think given the economic climate we're walking into and the inflationary times we're seeing, I do not think this is a surprise to everyone to see that recovery of increase in that being a barrier, up to 49%. What did surprise me is the one below it. 30% of people are now saying they are delaying care because they do not like going to the doctor. That is the highest it has been in the 4 years we have asked this question, which tells me we have an experience problem as a category right now. If people are choosing not to make their care a priority because the experience of going to the doctor is that bad. So a couple of flags coming through here in terms of what's going on and the barriers for people seeking care. Now, I did kind of touch on this earlier, but we do have an attitudinal segmentation in this study. We actually refreshed the segmentation last year. And that work, which is based on an attitudinal needs segmentation, revealed 7 segments of the population in terms of their relationship with healthcare and wellness. And you're looking at those 7 segments on this page. I'm going to do my best to very quickly give an overview of these segments. We do have a much more full and robust report behind these segments that if you're interested in, we're happy to follow up about. But on the next page, I'm just going to go through the high-level descriptions of who these folks are and really what their key defining attitudes, behaviors, and needs are. Now, the wellness influencers, they make up 16% of the population, and this is that really highly engaged, high-value segment group. Why? Well, they are the trendsetters, they are the influencers, they are hyper-engaged in their health and wellness. They are well, they are very healthy, they're very into diet, nutrition, they are big on leveraging technology, using smartwatches, monitoring their health, using the latest tools to track how they're doing against their health goals. But critically, they'll also spend a lot of money on their health and wellness. They're actually using lots of niche services to maintain their wellness levels. And they're very into innovation and the latest trends in healthcare. So a key segment for targeting for most of our clients. The habitual strugglers, conversely, they also make up 16% of the population, and they are not in good health. They are very engaged in the healthcare category because typically they have pretty serious chronic conditions that they need help with from us. And they're struggling. You know, they are struggling. They're not able to keep on top of these conditions. They're very stressed. And really what they're looking for from us is empathy, understanding, and emotional support with managing their health and wellness issues. Positive preventatives are also very engaged in healthcare, but for a different reason than the habitual strugglers. They're all about preventative health. They are spending on screenings. They'll make sure they're always coming in for their annual wellness visits and skin exams. They're very proactive as it relates to managing their healthcare. And again, they're a high value segment because they're seeing us to make sure that they're staying on top of their health. They're very positive in their outlook, very sociable, and just very organized. You know, they kind of take pride in the fact that they're very engaged with their healthcare and their physician, making sure they're getting those checkups. So those are the first 3 segments. These are the other 4 segments. The whole health managers is a really important segment for the industry to think about. The reason I say that is because this is an emerging segment who over-index with the younger generations. A lot of those younger age groups are falling into this whole health manager mindset. And that mindset kind of connects back to what Carolyn was talking about earlier as it relates to trust. This segment does not trust healthcare systems and healthcare organizations to do what's best for them. As a result, they will turn to you as a last resort. In fact, what they do is they self-care first. They then look to holistic and alternative solutions. And then if they really have to, they'll turn to you. So they're really about managing their health. They're fiercely self-reliant, have complete confidence in their own ability to manage and self-diagnose most of their issues and to stay on top of their wellness. The trusting traditionalists are kind of the opposites to the whole health managers. They skew older and they completely trust you to do what's best for them. You know, they're the kind of consumer who's had the same doctor for 20 years and whatever that doctor says is gospel to them. They don't subscribe to alternative therapies. They don't self-care. They have a very traditional relationship with you as a health system, but they do skew to a lot older as it relates to the population. The unapologetically unhealthy is a segment you probably don't want to target. They are the most disengaged group in terms of healthcare and wellness. They kind of laugh in the face of healthcare. You know, diet, nutrition, exercise, those types of things aren't really a factor in their lives. And they rarely engage in healthcare. Honestly, they'll only come to you as an absolute last resort. They don't really see healthcare as a priority compared to other things in their lives. I do want to talk about the doctor dodgers, and that's where we're going to transition to shortly, because the doctor dodgers now make up the biggest proportion of the population. 17% of folks fall into this segment. This segment is also one of the youngest segments in our study as well. and they have grown significantly in size in the last year. And they're an interesting group because they aren't who you think they are. You know, these young blue-collar individuals are avoiding care, not because they're apathetic about their health, like maybe the unapologetically unhealthy are. They just see it as a luxury. You know, they are very time pressed. They are often have big households and families to manage. They are often juggling multiple jobs. And the stress and the cost and the time involved to access care for them is too much. And as a result, they have to opt out because they have other priorities in their lives. So that was a very quick snapshot on our segmentation, but I do want to talk more about the Dr. Dodgers now. So this is the change in segment size year over year. You know, bearing in mind, we reran this segmentation last year, so we've got 2 years worth of data now. The big shift is in the Dr. Dodgers. In the last year, we have seen a 6% increase in folks who are now classifying as a Dr. Dodger compared to a year ago. We were 11% of the population a year ago. We're now at 17% who fall into that Dr. Dodger segment. We're also seeing an increase in the number of people who are struggling with their health, who fall into that habitual struggler segment. And then conversely, the most engaged groups are actually declining. So again, this story of engagement stagnating, you can see it even fall out in terms of our segmentation here. And if you're interested, we do have segment fallout by market. So if you want to quickly look up your market on this page, you can just see how many Dr. Dodgers are in your market. Interestingly, the most Dr. Dodgers are in Virginia, South Bend, and Charlotte. The least are in Ann Arbor, Gainesville, and Raleigh-Durham.
All right, we're going to switch gears a little bit at this point, and we're going to take a look inward. We wanted to go deeper into the industry-wide challenges that are associated with staffing shortages and really talk about how those shortages are impacting consumers' perspectives, specifically how they're feeling the impact of staffing shortages are having on them and what they're facing. So this is a really important slide because the data is indicating that the impact on consumers is much more significant than I think, even we expected to see. We know, and we have known for a while now, that the workforce challenges are keeping us up at night, but I don't know that we necessarily anticipated that our consumers, our patients, were necessarily feeling those as strongly as they are. But you can see here that 60% of consumers think that healthcare organizations need more staff. 72% think that there are staffing shortages that are going on in the industry. And then an incremental 72% think that healthcare professionals need to be treated better. So let's just think about that for a second. We have consumers who are telling us that we need to do a better job of taking care of the people who are taking care of them. It's pretty important and a pretty meaningful statistic that we should take seriously. So in addition to the top 3 attributes that we just took you through, the reason that we wanted to show the full list is predominantly because of that 4th metric. It is honestly just gut-wrenching. 64% of consumers feel sorry for healthcare staff. So the takeaway here is that consumers are not just seeing, they are very directly feeling the impact of staffing shortages. So tying this back to category stagnation that we talked about earlier, we are seeing people trying to avoid going to the healthcare provider. And we have to discern that part of that is because of the challenges that they are directly experiencing relative to the staffing shortages that are plaguing the industry at large. So we did want to explore a little bit more deeply with people to understand what they have done to sort of address these staffing issues that they're experiencing. So part of the unintended consequence of these issues is that an individual's orientation to sort of try and do things on their own is increasing. So Grant really kind of touched on that as part of the segmentation, but given some of the issues that they are directly experiencing relative to shortage, it's no surprise that consumers are really trying to take matters into their own hands and try and sort of self-care and self-diagnose, before they go to a doctor, which is essentially resulting in delaying of care, or in some cases, even using another channel. So in this particular instant, urgent care. And urgent care oftentimes is not sort of on an individual level associated with any sort of system and has a bit more of a retail feel, it becomes highly less personal, and it's really more about convenience and access. So the important takeaway on this particular page is that the real and perceived issues of staffing shortages are very much impacting and changing the way consumers are acting and behaving in the context of the healthcare industry. So you're probably asking yourself at this point, this is terrifying. What am I going to do about it? So to be successful, we really need greater definition around the employee side of the brand. So we need to take a real deep dive into understanding culture, what your people want from your organization, and essentially where the gaps are between those ideal and the current states. Then essentially we need to work to address and really build meaningful cultures for your people. And we have to anchor to that. Think, historically, as an industry, brand and experience has been first and foremost built predominantly with the consumer's needs in mind, oftentimes coming at the expense of your own people. But your employees are your brand. And if this chapter does nothing else, it should really illuminate for you that they are immensely critical to the experience that you are setting and essentially delivering on the strategic and executional desires of the organization. So really re-engaging in culture, defining what that is and what it looks like is going to be really important as marketers and brand leaders heading into the next year. And similar to some other chapters, we did want to give highlight to some of the brands that have done at least a perceptually good job of showcasing to consumers that we do put our staff first and that we do put our employees first. So we wanted to give credit where that is due. You can see here, interestingly, there are 2 in the Miami market out of the top 5. You see Emory sort of re-emerging, which we also saw in that trust category. So kind of an interesting correlation, right? We talked about how staff and perceptions of staff are directly correlated to trust. So it's not surprising to see some of the same brands showing up in this page as we did in previous chapters. We also want to acknowledge Valley Health System being on this list as well, and they're going to come back into the dialogue when we get into the brand rankings.
Thanks, Carolyn. So the next chapter is on self-care. And I think if you don't take anything else away today, take away what we're going to talk through in this chapter, because this is the biggest emerging trend that is happening right now. And I think we all have to think about what is our role in self-care given what is happening in this space. Pretty staggering stat for you all right here. 42% of consumers across the country now claim to practice self-care, which means managing their own health as well as self-diagnosing. That is a significant proportion of people who are actively managing their own health and self-diagnosing. Kind of referring back to the trend from earlier, this does match that engagement attribute of I often do my own research on my symptoms and or treatments. Even though engagement in healthcare and wellness is still stagnant and down, this is one of those areas that is increasing. More people are doing their research than the last couple of years. We actually ask across all of these channels, in what ways do you manage your health and receive care? Now, of course, the main channel is still in-person care at 89%, but self-care is the second. 42% of folks, as I said, are now practicing self-care based on that definition. And you can see also virtual care, with 1 in 3 people using online video, audio, and instant messaging to connect remotely to a doctor or healthcare professional is the next most used channel. So let's talk more about self-care and what that might mean for the future. Obviously, we've seen folks who are opting out of care. They're dodger doctors, they are whole health managers, they are doing care at home by themselves. And one question we wanted to pose to people in this study is that, thinking about the future and the list of possible healthcare tasks it might be possible to do yourself or self-serve, which of these would you be interested in doing by yourself at home if we gave you the tools and means to do so? So you can actually see the appetite for self-care across a whole range of different tasks here. Now, of course, taking monitoring diagnostics, temperature, weight, those types of things are the tasks that people are most willing to do. But I'm still surprised as you go down this list, there are still people in the population who would do a vaccination by themselves, who would do a skin exam, who would provide a blood sample. So, there is this desire for self-control, for self-management, even for the more complicated tasks among certain people in the population. And of course, we couldn't talk about self-care or talk about trends without talking about ChatGPT and AI. I think, this explosion in ChatGPT happened just after the fielding of this study. But of course, this is now another tool at folks' disposal as a means for self-care. And we actually, as an example, just asked ChatGPT, how can I better manage my high blood pressure at home? And this is the response we got. So I think we're going to see, again, an increase in reliance on AI and folks using these types of tools to manage their health and to self-diagnose. I think the value of the segmentation, going back to those 7 key segments, is honestly how they engage in the category so differently. And we really do see the need to segment in terms of targeting content and services for this reason. And this is a great example. When we look at that self-care percentage now split by segment, instantly you can see a big swing in the data if you're a whole health manager or a Dr. Dodger versus someone who classifies as a trusting traditionalist. And remember, the whole health managers and Dr. Dodgers are the youngest segments on this page. And they are the segments who are practicing self-care. So this is a big trend that we need to think about, especially when it comes to that next generation of consumers and our role and what we play in this self-care behavior.
Mm-hmm. Thanks, Grant. I think just to build on that, there's a direct correlation to sort of self-care and the role of content. So the intention of this chapter is really to specifically talk about, one, the evolving language of healthcare, but more specifically, how it should influence content, especially relative to these really diverse segments that Grant has spent some time talking about. So as you think about what you as marketers are really asking your people to build, one of the things that we would encourage you to do is really think about the consumers and how they want to digest content. Where do they want it to appear? Where do they want it to appear? And I think one of the biggest trends that we're seeing is that there's an interest relative to more wellness-based content over sickness-based content. So again, very much on trend with what we're seeing. Folks are not just sort of Googling or searching for content when they're sick. There is a real need for self-control relative to keeping themselves well. And we see that sort of being demonstrated on this page with the need for wellness content, including things like preference for nutritional advice, healthy food recipes, health checklists, information based on age and gender, online self-care tools and resources sort of all popping to the top in terms of the types of content and resources that all of our segments are looking for. We also wanted to take a peek at how the channels that people are using have maybe evolved. And so we're really interested in sort of understanding how people are wanting to receive information from us. And sort of given some of the levels of control over their health and care and wellness, it's not surprising to see some of the formats that are rising to the top. So self-service content formats like fitness trackers, Google search, article posted on general health and wellness sites. These are all channels that are self-serving, that enable and empower many of our segments who are interested in this content to find it on their own. And so it's important to be thinking about your content strategy and how that should be considered relative to the right channel and the right audience to ensure that there is a sense of empowerment going on when you're planning what you're putting out into the world. So really similarly to one of our previous chapters, we spent some time talking with a number of members of the Virtua Health team relative to this topic. And what was really interesting about the content exploration that they were sharing with us was more specifically around what shows up sort of relative to the evolution of the healthcare vocabulary. So in our discussions with Christy and Ryan and other members of the Virtua Health team, what really emerged was this need to sort of emphasize being comfortable and confident in telling your story. doing that in a way that's really authentic and really thinking about how some of the stories that we're telling are really shifting away and growing over time. And in many ways, I think being okay with that, letting that evolution happen in very natural and organic ways. And then I think the last point here to make is be relentless in the ways that you're getting your message out and your stories out into the market. We have to be unique in the way that we bring our brand to life and how we tell our stories. We are competing for really, we are competing for a lot of headspace. And so making sure that we are doing so in a really differentiated way is important. So what we've done on this page, it's quite a lot of content, but it is a bit of a checklist of sorts to sort of, in your efforts, think about how you can make content as effective as possible. So again, if the goal for consumers is really all about control, how can we think about content and how consumers are going to look for that? So just a couple of highlights here. Real talk in real time is going to be really important. We all know that consumers are bombarded with messages. The value that we provide with relevant and relatable content is really going to matter in the moment with breakthrough opportunities to simply be remembered. So know the journey of your desired audience and really focus on intersecting with it. Another piece that we wanted to highlight here is that not every piece of content needs to be actionable. So shifting your thinking from, and your organization's thinking from, what do I want people to do, to really, how do I want our patients and potential consumers to feel? What this is going to do is really give us permission to show up and be present in our consumers' lives in really more meaningful and diverse ways. It's freeing us up in a way that realizes that not every message has to be intended to be independently driving a metric. And that becomes really important and also more authentic in terms of how we're communicating. The last I wanted to highlight here is just have empathy and spread the equity. Asking the question, how can we help, is more important than ever, especially in the sea of sameness and the stagnation that we're really seeing in the industry. So consumers want to be understood. They want to look for partners in their health, not superiors. And so it's really important for healthcare for us to get that right. Healthcare is a right. It's not a privilege. And it's our responsibility to make sure that we're connecting to everyone who needs us, no matter what they are. So really quickly, just want to touch on this just as to really re-illuminate that each segment needs to be looked at in separate ways. So if we just take, for example, the whole health managers, you can see here on the slide at 12, a 12% bump, holistic health seekers are seeking advice on health and wellness. In contrast, the trusting traditionalists are at a -4. So the intention behind this slide is to illuminate that not all subject matters are created equal, and you really do need to be thinking about who you're targeting and make sure that your content meets their needs. And the same holds true from a channel perspective. So if we sort of take as an example, the positive preventionalists, one of the places that they're looking to do is look to articles posted on healthcare organizations' websites. Sort of in contrast, habitual struggles, even wellness influencers, and definitely doctor dodgers, as an example, are not actively looking for articles being posted on websites. So channel matters and content matters when you're thinking about your audiences.
Thanks, Carolyn. I'm going to go pretty quick through this chapter so we can get to the brand rankings, but I do want to touch very quickly on this premium care model and the appetite we're seeing around premium care in general. As you can see, based on this trend here, folks are saying it's worth the extra cost to go to a better healthcare provider or facility, and that trend is still pretty strong at 65% this year. So what are people are willing to pay for? How willing are they to pay to receive different benefits attached to healthcare? Well, you can see that advanced diagnostic testing and a more proactive approach, treating illness before it becomes a chronic issue, are two of the top things that people are willing to pay extra for. We also tested interest in these two modes of care, concierge medicine and direct primary care, with the definitions below there is what respondents saw in the study. And consistently, we're seeing about 1 in 4 folks in the population who are interested in these premium healthcare models. And of course, this is again going back to our segments, why we segment, because if you are a wellness influencer, your willingness to spend on this type of premium care model is much higher than any other segment in the population. It is a risky bet though, You know, we do see with these types of premium care models that they are polarizing. Some folks see the benefit. They see it as a way to get past the access challenges they're facing, the wait times, the delayed care that can really impact their health and wellness. Whereas other folks see these types of models as actually making the problem worse. You know, by actually enabling people to pay for faster access, you are hurting other underserved groups of the population and, you know, impacting the equity of care essentially by these types of models. Okay, so I do want to get to the rankings and then we'll take questions. The rankings are an important part of this study. On the next page, we talk a bit about how we measure brand. Now, we do have a very robust and validated framework that we're using to create the rankings. The rankings are based on consumer ratings that feed into our model. And this model is based on years of social science in terms of how human beings experience brand through all of the senses. It is a model, though. It's not just a social construct. We are using a structural equation model here to predict choice and advocacy in care. And what we actually do is we evaluate brands in the markets they exist in. So even though this is a national study, we're only ever evaluating healthcare brands in their markets with consumers who are at least somewhat familiar with those healthcare brands. So you can be a user, you can be a non-user, it doesn't matter. As long as you feel a level of familiarity with that brand, you are allowed to evaluate that brand in that market. We take the scores from this model and we do produce the rankings. I do just want to show you some of the drivers that feed into that scoring. Mm-hmm. There are 4 key dimensions in the model. The first is the sensorial, which is really about how people absorb brand through all of the senses: sights, sounds, smells, really anything we can do to kind of drive that top of mind awareness of our brand and make our brand noisy and visible in the marketplace. These are all of the drivers that feed into the sensorial dimension of the model, and they've remained remarkably consistent in terms of driving importance in our model year over year. But certainly, these are the types of attributes that we dig more into. For people that subscribe to the study, you can actually see how you perform against these attributes in your market. The next dimension is the intellectual, and these are the much more functional aspects of care. Being perceived to have the best people is consistently the #1 driver here. The third dimension is the emotional, and this is really how we make people feel in terms of their health and wellness. And are we delivering on those implicit needs they have? Are we giving them that security and that freedom? 2 of the top drivers as it relates to this emotional dimension. And then lastly, the 4th dimension in the model is much more behavioral based. And this is all about what people do with your brand inside and outside of care. Every interaction digitally, physically with your staff feeds into this particular aspect of the model. And you can see that interactions overall and having positive interactions is the #1 driver, as well as taking the stress out of care and making lives better. So we take all of that information, all of the performance across those attributes, they do feed into the model and they create a brand score. It is that brand score that dictates your national rank position. And we do use a weighted moving average over the last 3 years so that you have to consistently score well to feature in the top 10 in this study. So who are the top 10? Out of the 207 brands we evaluated across the US this year, these are the 10 best brands based on consumer ratings. And big shout out to Valley Health System in New Jersey. I mean, incredible performance, being the #1 brand in the US. I think it goes to show that from a consumer perspective, bigger isn't always better. You know, I think it's more about that relationship you have with consumers versus being an AMC or being a big system. It's about those personal relationships, and no one does it better than Valley Health System. Some other really impressive entrants in the top 10, Ohio Health at 2nd, University of Iowa Healthcare at 3rd, Johns Hopkins consistently up there year after year, UR Medicine, Baptist Health, Northwestern Medicine, University of Miami Health System, UT Southwestern, and the Ohio State University Wexner Medical Center all make up the rest of the top 10. There are 207 brands in this study. I'm not going to go through them all right now. Mayo Clinic just missing out on the top 10 there. So we'll skip through these, but these will all be in the full readout that we send, obviously, when we send this recording over. Did want to call out the top 10 biggest movers this year. These are the brands that have jumped up the highest in the rankings. McLeod Health is the biggest mover. You can also see Northwell Health, Torrance, Sparrow, Nuvance, Alina Health, Emory, St. David's, M Health Fairview, and Henry Ford. These are the brands that have improved the most in the last year, so well done to you. Every year we talk about disruptors though, and I want to give a shout out to these disruptors on this page. Why? Because even though we don't put them in our traditional rankings, were they put in the rankings, all of these disruptors on this page here would even beat Valley Health System. That's how good they are. Heal is the #1 disruptor this year, followed by Parsley Health, Kindbody, Maven, Forward, and Carbon Health. These are the brands to watch out for.
All right, let's bring this home. We have made it to the implications and the key takeaway side. So thank you for hanging with us. We have 5 considerations that we want to share with you today before we address some of the questions that you've been posing in the chat channel. So first, we want to highlight the importance of working across imperatives. So this means not just thinking about marketing today only. We need to be thinking as brand people, but we also need to be thinking about stretching ourselves across the entire enterprise to really impact people in ever more interesting ways. So as marketers, I think we have a unique perspective and a unique ability to understand how to effectively collaborate. So when we think about how to bring stories to life and ultimately know how to own the why, we can bring that influence to the broader organization. So on each of these pages, just to orient you to what you'll see when you get this deck, on the left-hand side, we're sort of teeing up the idea, and then essentially on the right-hand side are our potential action items. Think of it as a bit of a checklist for each of these 5 imperatives. So that was the first one, really highlighting the importance of working across imperatives. The second implication is all about rebalancing brand strategy as well as experience, orientation, and culture. So we need to be really thinking equally about internal and external audiences' needs. So what has really happened in healthcare that we've talked about during the study is that we've gone full on with consumer orientation, and for good reason. But what we're seeing now in today's market and with the workforce challenges that are impacting the environment, it's more important than ever to bring back the employee perspective. We need to bring their point of view back to the table. And this is going to be extremely important going forward, making sure that how we are positioning and talking about our brand is also relevant to the culture that we're building and aligned with what our employees need, not just what other consumers need. The third imperative is all about making sure that we define the orientation to systemness that's really best for us. So this reflects what we want to accomplish. That might be, for example, maybe rethinking your own positioning and the role of systemness plays within it. It could be thinking about how decisions we make around brand and experience impact systemness, or perhaps it's systemness that we want to create. Then, of course, the opportunity here is to measure this potentially in new ways and basing that on the benefits that we're trying to deliver to people through our definition of systemness. So the fourth is to think and rethink the role and performance of our content engine. The question that we need to be asking ourselves is, what role in this age of stagnant category engagement does content and channel strategy play in the lives of people that we serve? So this could mean that we need to be rethinking the role of content overall, or making sure that we're looking at things through the lens of our audience segmentations. And that doesn't just mean the content that we are developing, but also thinking about where we're placing that content. So what we're saying and where we're saying it matters. And that information is really important in order to deliver meaningful and relevant experiences for those that we're serving. And finally, like we have sort of demonstrated in many of our last HBE readouts, is this notion that we have an opportunity to reorient ourselves to acting like a chief customer officer. So this is a role that is much more common in other industries. And one of the things that I think we see in healthcare is that sometimes we think we need permission or encouragement to define and then own a different role within the enterprise. So chief customer officers typically take on an increased responsibility for enhancing experiences. So as marketers and as business leaders, we have an opportunity to take that responsibility on for the broader set of experiences and cultures, as well as think about how brand work can sort of help the organization to realize the benefits of taking on this new and differentiated role. And with that, that rounds out the content for today's discussion. I would love to turn it over to Grant, who has been monitoring our questions throughout the duration of our chat, and we're going to use the remaining minutes today to answer some of those for you.
Yes, thank you for being patient with us. That was a lot to get through, and we haven't left a lot of time for questions. So I'm going to take a few of the questions now, and we'll get to the rest of them as a response after this session. I do want to go back to one of the first questions, which really talked about, the question is, I'm most curious about engagement with patients via a provider's electronic health record portal. Was that factored in, or did it come up in your research? So I can take this one. We don't look at portals specifically in this study, but I will say, as we go back to the systemness chapter, that for us, the fact that consumers tell us that as a system, the reason they would use us is that we should be making it easier to access their patient records and better communication, that absolutely the health portal is a key way to address that. So, I think that we are looking at making portals as user-friendly as possible, leveraging apps to really help health systems create that seamless experience for consumers because they expect it from us. Another question I see in the chat, and maybe I'll give this one to you, Carolyn. Healthcare consumers think providers need to be better treated, but they distrust them. How does that work? Why are they saying they distrust us, but they also feel like they need to be better treated?
Yeah, it's a really great question, right? It's probably a little bit of a chicken and the egg type of a question. It's sort of a cyclical loop, right? The way with which we are treated as consumers in a healthcare environment directly impacts our degree of current and future trust. If the person whom is caring for us is not in a good place, that they don't feel that they can trust their organization, that they don't feel valued, imagine the experience that they are going to be having with a patient. It's likely not to be super great. So if you think about this in sort of this cyclical pattern, there's an acknowledgement that healthcare providers and care providers are clearly in a state of distress, but that's also directly impacting the way with which we are receiving care in real time. And so I think that there can equally be an acknowledgement that healthcare providers need to be treated better and differently. If not for nothing else, then I would anticipate as a consumer and as a patient that my experience will ultimately benefit from happier providers. So, I think that's really the interesting correlation between distrust and also the acknowledgement that that distrust is probably in some capacity stemming from unsatisfied or dissatisfied and unengaged employees.
Perfect. And I'll take this last question and I'll answer this one before we just wrap up for today. And apologies if we didn't get to your questions. How are the systems chosen? There are many more than 200 healthcare systems. Were they grouped by size? So this is referring to the rankings. It's a great question. I mean, the number of brands we've ranked year over year has grown every year. And honestly, it's a combination of size, but also where our subscribers to the study want to benchmark against. So, we are expanding the list every year. If your brand isn't on there, let us know. We can add your brand, we can add your market. But yes, it's kind of organically grown year over year. And by now we do have most of the big health systems on there, but not all of them. And we are always looking to add more to the study. So with that, I am going to just close out for today and say thank you for listening patiently to us. And I'll just pass it back to Daniel and team to wrap up.
Thank you, Grant. I'm sure the audience joins me in thanking you and Carolyn for that terrific discussion. Thanks also to all of you in our audience for carving out time to join us for such an important conversation. Please note that if you asked a question that we weren't able to get to, we will do our best to get a response to you. The forum will also be sending out a link to the webinar recording in the next few days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, including 2 upcoming programs on June 7th and June 14th. Check the forum website at healthcarestrategy.com for details. That concludes today's program. Thank you and have a great day.